Hello, my name is Tanya, and I'm the training instructor for Ondek Healthcare. This orientation is going to give you an overview of what to expect when you're working with National Church residents. So please take notes. A knowledge test will have to be taken and passed at the end of this orientation. So let's get started. Senior Living Facility Orientation for Support Staff. The mission for National Church Resident originated from a Christian commitment of service. Their mission is to provide high quality care services and residential communities for all seniors. Their vision is to advance better living for all seniors, enabling them to remain home for life. Their position is to provide high quality care to their seniors. Their promise is excellent that transform lives. So they have four core values: mission, compassion, professionalism, and leadership. The mission, they are driven by a deep sense that their work should serve God and always produce good for others. Their compassion, they truly care about people and seek to treat each resident, employee, and neighbors with dignity, respect, and fairness. They strive to be excellent at what they do and to be sound managers of resources with solid ethical business practices. Leadership. They will be leaders in the field, setting a good example for others, visionary, growing inclusively, and constantly improving. Person-centered care. What does person-centered care mean to you? Think about that. Person-centered care is exploring how people and their families at the center of any care and support decisions or interventions. The resident is put at the center of care and is able to choose how they want their care support to be delivered. So person-centered care promotes positive well-being, supports independence, improves quality of life, honors choices, enhances dignity, and empowers residents. Patient-centered practices include deliver what the resident wants, focus on the patient-staff relationship, make sure staff respond to residents' questions and needs, know your residents, look for and remove obstacles to patient-centered care. Person-centered care practices is respecting the individual. Get to know the resident and recognize their unique qualities. Treat residents with dignity. Understanding their experiences and goals, maintain confidentiality, give responsibility to the resident, coordinate care with the resident. So PCC examples would include relate to one another as human beings, help them make the most of their abilities, because there are always abilities, enable residents to make choices no matter how small or large they may be, support feelings or even when a resident has difficulty expressing them. Treat others as they wish to be treated. So communication skills would include the following: open-ended questions, which are questions that cannot be answered with a yes or a no. Not interrupting the resident. Take time to listen to the resident and enhance greater resident engagement. You want to collaborate with the resident on the following items: medication times, meal times, picking what they want to eat, when do they want to get up, what activities do they want to participate in, when do they want to take a shower, and what do they want to wear. So here's a video that you can watch. You can find this YouTube video kind of giving you information more about what is person-centered care. Infection control. Hand washing is the #1 defense against the spread of infection. You want to always wash your hands with soap and warm water for 20 seconds. You want to wear gloves when coming into contact with bodily fluids. And we all know that alcohol and hand sanitizer does not work with VRE, C. diff, or norovirus. So please wash your hands. Standard precautions are intended for the care of all residents regardless of their diagnosed or presumed infectious status. Standard precautions include gloves and proper hand washing. Airborne transmission occurs when the pathogen remains in the air for prolonged periods of time. These pathogens are usually carried in the air long distances. Disease transmitted in this manner are very contagious and can be very serious. The proper PPE is gown, mask, eye shield, and gloves. Droplet transmission occurs when droplets are infected with pathogens are transmitted from the source to the host. Droplets are most often caused by coughing or sneezing. The proper PPE is gown, mask, eye shield, and gloves. Contact precaution are used when infection is spread through contact with infected skin or surfaces. So residents are going to usually be in a private room. If that's not possible, then they will be placed in a room with another resident that has the same active case of the same disease. Always remember, with contact precaution, gloves and gowns are extremely important. Always change your gloves and wash your hands after touching an infected area of the resident. Remove gloves and gown before leaving the room and wash your hands. So let's go over some COVID protocols for the facilities you're going to be going to. You must be screened at the door, so make sure you're checking your temperature and logging it in the book. If it's your first assignment, you will get tested for COVID just to make sure you don't have any COVID. You must wear your mask at all times. If you're unvaccinated, you're going to wear an N95 mask and you'll be tested twice a week. You can wear a surgical mask if you are vaccinated and the county exposure rate is less than 10% and there's no positive residents at the facility. Make sure if you're unvaccinated that you have completed your medical and religious exemption form and send that over to onboarding. Masks and 95 masks are available at the facility at any time you need it. So you can always change your N95 mask daily or in between patients if need be. If you're feeling sick with COVID symptoms or you've been around anyone positive of COVID, please make sure you let us know so that we can take the proper precautions on what we need to do. And we'll also have you get tested. Make sure you're wearing your mask correctly. Do not wear your mask below your nose. Wear it over your nose and make sure it's secured tightly on your face. You must always have your mask on unless you're eating, drinking, or outside the building. If a resident is on isolation, you must follow the recommended PPE. Do not wear gloves or PPE outside the room or in the hallways. Make sure you remove your gloves and wash your hands. If there's a sign on the door, please check with the nurse first before entering into that resident's room. Sometimes, if a resident is on isolation, they may be a new admission, and so that resident is going to be placed on quarantine for 5 days. So this is just some information about COVID elopement procedures. So let's go over the definition of wandering. It is a random or repetitive mobility, either by walking or moving using an assistive device, such as a wheelchair, and can be goal-directed, such as exit seeking, or non-goal directed and aimless that could lead to an unsafe situation, including elopement. Definition of near-miss elopement is when a cognitive patient exits out the facility but was witnessed by a staff and that staff was able to redirect that resident. That's considered a miselopement. And then elopement occurs whenever a resident is cognitively impaired. They leave outside the facility and there was not a staff able to witness that resident, and they therefore you're looking for that resident, they become missing. At that point, they're considered elopement. So assessing for elopement. Each resident is screened on admission for risk of wandering and elopement. Each cognitively impaired resident without behaviors will be observed for the first 72 hours for elopement risk using the post-admission assessment. Any resident with exit-seeking behavior or unsafe wandering will be reviewed every 6 months. Additional assessment will be done in a mini-cog and BIMS, or if significant change in condition occurs. If a resident displays exit-seeking tendencies, then further evaluation is needed to determine if a resident needs to be on a secured unit. So what can you do? You can identify those residents at risk in the book at the nurse's station. There's going to be a picture with the resident's name and letting you know that they're at risk for elopement. If it's a new resident, we want to make sure we provide enough staff to assist them with their surroundings. You want to make sure you do not leave any resident unattended in the hallway, the dining room, or the activity area. You want to use a wander management system if that's something that's needed. You want to make sure when you're entering and exiting the secured areas that there's no resident following you out the door. And you want to have a handoff to another staff member if going outside of the unit. So again, elopement must be reported to the DON and the administrator immediately. And if they are suspected of being missing, that should also be um, reported to the DON and administrator. All contact information is going to be found in the agency binder at the nurse's station. So you'll be able to have the DON's phone number, the administrator's phone number, and any other phone numbers that's part of administration will be in that binder. So staff responsibility with resident exit seeking behavior. You want to attempt to prevent the resident from departing. You want to obtain assistance from other staff members and verify that it is safe for them to leave unsupervised. If the resident is allowed to leave unsupervised, you're going to verify that the resident has signed out. If not safe to leave unsupervised, have another staff member notify the DON or administrator. So if you hear the alarm sounds, you want to make sure you check the alarm panel near the door to determine if the door has been opened. You want to attempt to prevent the departure by redirecting the resident. If resident is resistant to redirect and exit the facility, go ahead and remain with that resident until they are safely returned back to the facility. You want to do visual checks of exit doors and areas around exits. You want to complete a search of the property. Then you want to reset the door alarm when all residents are accounted for and no resident has exited inappropriately. When an elopement occurs, at that time the nurse is going to announce a code white, which means missing resident. You're going to conduct a search within the facility. The nurse is going to run a midnight census and a PPC, and they're going to verify each resident is present on the report. If resident is unaccounted, you're going to institute a search of the property and surrounding areas. After 15 minutes, you cannot locate the resident. You're going to notify the staff in charge immediately, such as the DON, the administrator, the family, the attending physician, the police. When you notify the police, you're going to provide a picture of that resident from the elopement book and give that to the police. When a resident is found, an assessment must be completed to determine if the resident needs any medical attention. The DON will determine if the resident needs to be sent to the ER or further evaluation or treatment. Going to notify the search team that the resident has been found, announce code white, all clear. Then you're going to notify the physician and family of the resident's condition. You're going to implement any new physician orders, update the care plans, complete an incident report, and add the interventions to the resident cardex. And then at that time, the resident will be placed on one-to-one. Following up interventions, upon return to the facility, an assessment must be done to rule out any injury. You're going to implement a visual check sheet and monitor the resident whereabouts every 30 minutes. You're going to secure an alarm bracelet or armband needs to be initiated. If resident has a secured alarm bracelet, you're just going to verify that it's working correctly. You're going to identify any additional interventions based on healthcare team review to prevent further incident. You're going to determine if they need to be removed to a secured unit. You're going to re-educate regarding facility policies and procedures for signing out of the facility and documenting in the medical records. The IDT team may determine that the resident may be discharged, considering discharge against medical advice should another missing resident occur. Residents at risk for elopement outside the secure unit will have a wander management device. You're going to place it on the resident and not on the wheelchair or walker. You're going to generate a physician order and include the device serial number on the order. And then the licensed nurse is going to check placement of the resident device every shift. Going to check functionality on the resident device daily. You're going to check and document the expiration date daily, and you're going to use the resident's care plan and task list to communicate changes. Emergency codes. So emergency codes are as follows. Code red means fire. You're going to close all the doors, clear the hallways, and then the staff is going to report to the appropriate staff. If there's ever a tornado watch, you're going to announce code gray watch. At that time, the charge nurse will listen to the radio for weather updates. They're going to review the procedure and inform the staff to be prepared for further action necessary. You're going to provide a bath blanket for each resident in the room and close their blinds, clear the windowsills, and pull their privacy curtain. If there's ever a tornado watch, you're going to announce code gray watch. You're going to calmly clear the halls of any obstacles. If the resident is bedridden, you're going to cover the resident body with a blanket, pillow, etc. If a resident is ambulatory, you're going to try to get them on the floor in a cowering or sitting position with a pillow behind their head. If there's violence, you're going to announce code violent. If there's a bomb threat, it's code orange. If there's an elopement, it's code white. If it's security, it's code 10. And then if there's ever an active shooter, you're going to use the Alice protocol, which is alert, lock down, inform, conquer, and evacuate. So just remember, whenever you are using a fire extinguisher, you always want to use the pass method. And there's a video for you to watch. Oxygen safety. There's going to be a sign posted outside the room where oxygen is being used or stored. If the resident is going to be in a beauty shop, there's no oxygen allowed under the hairdryer. Only nurses or respiratory therapists can set or adjust oxygen. There's no smoking around oxygen. There's no electric razors around oxygen. There's no petroleum-based products with oxygen. And always remember, electric equipment should be grounded. Each facility has a designated area to store oxygen cylinders. Cylinders must be stored in a rack or fastened to protect against accidental damage or dislocation. Partial or full tanks will be stored separately from empty cylinders. Cylinders should be transported in a secured oxygen holder. So just some quick tips. There's no cloth mask allowed. If you work 8 hours, you are entitled to 1 free meal. If you work 12 hours, you are entitled to 2 free meals, and all meals are prepared by a chef. Just remember, if this is your first assignment, you will be swabbed on arrival. And if ever you have any issues with possibly getting stuck in traffic, or if you're running late, please call this number. This is the scheduler's number for Ondek. Inform them what's going on so we can let the facility know what's happening. No calls, no show is not tolerated. Also, just remember that whenever you do pick up a shift or if you work in a contract, the scheduler is going to be contacting you the day before and the day of to confirm your shift. So please, if they text you or if they call you, just say, yes, I'm coming in for my shift. I mean, a simple text would be fine with just replying back, yes. That's something that's standard for Ondek Healthcare. Thank you for attending the orientation. What I would like for you to do is email Jamari. This is his email address, jamari@ondekcare.com, and just let him know that you have completed your orientation. And if you are going to be doing a 4-week contract, we will have the scheduler reach out to you, and she'll go ahead and email you the contract over. And then we're also going to send you an attestation, which just means that you did attend this orientation, and you will be receiving a knowledge test at the end of this orientation. So please use your notes to take that test, and it has to be passed before we can send you out to work. otherwise than that, I thank you, and National Church residents thank you, um, and welcome you to their facility. And they care very deeply about their residents, so we hope that you will go and take care of their resident and treat them with respect and dignity. If you have any questions, please reach out to the scheduler. Like I stated, the phone number is there on the slide previous to this one. Thank you and have a good day.